Good evening, I'm Adrienne Arsenault. Tonight, anxious nurses tell us they're worried for their safety.
We need to be protected.
And the government acknowledges there's an equipment shortage.
I'm Andrew Chang. Also tonight, getting tougher on physical distancing.
We must absolutely implement stronger measures.
Why you'll be measuring your stay at home in months.
Very often we say, customer is number one, right? But I don't think in this case it's true.
The message from grocery store workers to socializing shoppers: enough's enough.
And on the 1st of this month, details about desperately needed federal funds.
Get ready to rehire people.
We'll explain how businesses get it, and our financial experts answer your questions. This is The National. As the global pandemic begins a 4th week, it is clearer than ever that Canada's collective ordeal has barely begun. The message from leaders today is that the call to stay isolated will likely continue for months.
So Andrew and I still keeping our distance, a measure more plainly necessary since we started doing it nearly 2 weeks ago. And like you, we'll keep it up as long as it takes. But how long will you be asked to confine your everyday life? Today, we're learning there's risk involved when leaders aren't clear on that question. Chris Glover looked into that as Canada's biggest city, the one you see behind me, was ordered to settle in for the long haul.
It's a lonely time to celebrate your 2-year anniversary in Canada, says Aboud Albana.
It's really empty, really sad.
Most businesses are closed. Gatherings in public, even private spaces, are banned. He just learned this physical distancing will last for 12 more weeks in Toronto.
It's heartbroken,
Locking the city down as much as any municipal government possibly could will save lives.
So far, 19 deaths in Toronto. The fear is it'll get bad like New York City, where roughly 1,100 people have died from the virus.
We must absolutely implement stronger measures.
And so the lockdowns from coast to coast intensify. 4 people in Nova Scotia were fined $700 each, 2 of them for not standing 2 meters apart in public. In Ontario, if you're caught breaking rules and don't identify yourself, police will now add on a $750 fine.
We're facing a ruthless enemy. There's very little separating what we will face here in Ontario from the devastation we've seen in Italy and Spain.
New research surveyed 900 Italians during the pandemic. It found people are most likely to disobey lockdown laws if timelines are promised and broken.
They report they would be more willing to respect fewer rules, fewer guidelines, and even to transgress the law.
He points to the U.S. president, who at first downplayed the virus.
The credibility of the deadlines, of the end dates that they establish, might actually make a difference in making people comply and stay at home.
Now Doug Ford knows I came out shopping.
Norma McDowell is only teasing. She applauds her Canadian leaders.
I don't think you can predict this kind of thing. It's like being in a silent war.
It's just like to be grateful for what you have.
Instead of celebrating this year, Albana is just grateful for his health. Chris Glover, CBC News, Toronto.
Now let's take a look at the situation across the country. 129 people have now died, and Canada is closing in on 10,000 cases. The biggest jumps today: Alberta with 117 new cases, Ontario with its biggest one-day count yet, 426, and Quebec, which saw 449 new cases. But Canada's chief public health officer says those numbers tell only a part of the story.
What you don't see with those numbers is when did these people get sick? What is the trajectory of this outbreak look like? And that's what an epidemic curve is.
Canada's curve is subtle until early March. Then it skyrockets. That's the lag between infection and reporting. Now, we don't know how it'll end, of course, but we know of at least 2 potential outcomes. The path where Canada lets its guard down, overwhelming the healthcare system, or Canadians heed the government's warnings, flattening the curve, buying time. And for Canadians clinging to the idea that youth is a natural defense, look at these figures. About half of all cases are now people under 50. Vicadopia takes a closer look at the changing demographics.
Every day it's a challenge. But
Rene Segura landed in the ER after difficulty breathing. His condition worsened, so he was put on a ventilator, just like another patient in the ICU with COVID-19.
Unfortunately, he didn't make it. And I guess that's when reality hit, that there's a chance I may not make it home.
Segura is now recovering at home. Before this, the 41-year-old was otherwise healthy. His age group, people in their 40s and 50s, make up more than a third of diagnosed cases in Canada, followed closely by younger adults. And of those sent to hospital, about 1 in 8 are under 40.
So it means that we're all susceptible.
This U.S. researcher is looking at factors behind the differences in the spread of infections.
You know, we have U.S. and Canadian kids going down to Florida and crowding on the beaches.
And that crowding continues today, at least at this popular park, which is supposed to be closed. The idea that younger people are somehow unaffected persists. Epidemiologists say they can spread the illness to others, yet that message may have been overshadowed by the fact that it's still the elderly most at risk.
I believe many people in my profession, myself included, have dropped the ball a little bit on how best to communicate risk, outcome, and relative importance of this moment in history.
That risk and where we are in this outbreak will be determined by the precautions we take or don't take, no matter the age. Vic Adopia, CBC News, Toronto.
The COVID-19 outbreak at a nursing home in Bobcaygeon, Ontario, has now claimed at least 2 more lives, bringing the total to 14 residents and 1 resident's spouse.
I've been doing family medicine for 30 years and in nursing homes for all of that period. I've never had so many deaths in such a short period of time. This is just unprecedented.
At least 24 staff members have also tested positive for the virus. Pinecrest is one of more than 24 seniors facilities in the province dealing with cases. So as we mentioned, Ontario's case count spiked today, and political and health leaders are warning the worst could be just around the corner. Thomas Dagla now with the fears on the front lines and the preps already underway.
Yes, it's come to this. A makeshift hospital going up in Burlington near Toronto for fear the coronavirus will stretch regular facilities beyond capacity.
Right now we are in the calm before the storm. We are essentially creating surge capacity based on the worst case scenario.
The new structure will house up to 93 patients, freeing up space inside the hospital for more intensive care beds. Right now, Joseph Brant Hospital only has 5 patients in the ICU from COVID-19, but plenty more are expected, and not just here.
There's very little separating what we will face here in Ontario from the devastation we've seen in Italy and Spain. Thousands of lives are at stake.
Those countries worst hit saw their intensive care units overwhelmed. Ontario has 145 confirmed cases in ICUs and 340 more suspected. The case count is doubling every 4 days, with a surge expected soon, 2 weeks after March break travel.
Sometimes in the next 4 or 5 days, some of them will be hospitalized and some of them may be going to ICU and be vented.
Ontario's total number of confirmed cases keeps growing steadily. Compare that to BC, where the curve is slowly starting to flatten.
You see that they are at peak, near peak. They've got this under control, and Ontario does not look that way.
There's a backlog for Ontario test results, plus a need for better testing in general, says this epidemiologist, comparing vulnerable patients to sitting targets.
If you're not doing good surveillance, this is like a shark swimming around under the surface of the water. You're only going to know about the epidemic once the paddle boats start disappearing. And that's the situation in Ontario.
There may very well be the need for more makeshift hospital wards elsewhere before it gets better. Thomas Dagg, CBC News, Toronto.
Okay, let's turn to Dr. Isaac Bogosh, an infectious disease specialist who's been helping us understand the pandemic. So, Dr. Bogosh, what is your understanding of where we're truly at? I mean, is BC really flattening? Is Ontario really getting worse?
It's kind of hard to know right now. And certainly we all hope BC is flattening, but I still think it's too early to be optimistic that that's the true trend that it's taking. And we're going to need a little bit more time to see if that's actually sustained And similarly, in Ontario and elsewhere in the country, in Quebec and across the board, we are starting to see the expansion of diagnostic testing. And in Ontario, for example, we're watching our Ontario work through that big backlog of tests. So it's kind of hard to interpret these numbers in a meaningful way. And again, just like in BC, the real test is going to be what happens in the days and in the week and actually 2 weeks ahead. Only then will we really know if this is being flattened.
And when public health says to expect a rise in cases, what are we supposed to do about it?
I mean, we're just supposed to hold the fort and really practice our physical distancing measures so that we prevent community transmission of this infection.
Dr. Bogosh, thanks very much.
Anytime.
So as cases of the virus mount, the outcry for personal protective equipment just grows. But today brought some frank warnings about problems in the supply chain. David Cochrane has the leaders who laid out some cold, hard facts.
The federal government came into this crisis with an emergency stockpile of supplies and a big unanswered question. Will it be enough?
No, we likely did not have enough. I think federal governments for decades have been underfunding things like public health preparedness. And I would say that obviously governments all across the world are in the same exact situation.
In the exact situation, and now all trying to buy the exact same things. There's a global run on the masks and gloves that every health worker needs. Supplies are being rationed in Canadian hospitals and are becoming increasingly hard to get on the market, even when you think you have a deal.
There is a whole saga behind the scenes of inventory that doesn't exist, of orders that disappear, and quite frankly, of deliveries being purchased from underneath us at the plane by other jurisdictions outside of Canada.
Those market conditions emerge as some provinces scramble. Hard-hit Quebec has burned through a year of supplies in a single month, showing just what the country is up against.
Health systems were never designed for this kind of surge. And so that is the challenge.
This is precisely why the government has signed deals with companies to make these supplies here in Canada. That global competition will only increase, and it's becoming more and more difficult to rely on other countries for help. David Cochrane, CBC News, Ottawa.
So that equipment destined for the front line, much of it for Canadian nurses who are charged with taking care of the sickest of the sick. But from all across the country, they're telling Wendy Mesley they don't feel safe doing that.
This video was smuggled out to us anonymously from a big city Canadian hospital because we weren't allowed in. On the way to intensive care, you can see the visitor seats blocked off. The halls are empty. But one doctor told us they all know a tidal wave is coming.
Colapsando las urgencias.
This is the nightmare scenario. This New York Times video shows hallways in Spain jammed with sick patients, nurses making their own protective gear. And now, photos on Facebook suggest it's starting here. Patty Tamlin got SARS on the job in 2003. She's still an ER nurse, but now her husband is battling cancer. She says she would never quit, but
if I do not have the equipment that I need to walk into a room, I have myself, I have my husband, I have my children and grandchildren that I need to protect ultimately.
Dozens of other worried nurses told us they fear losing their jobs if identified. But one shared this email from her hospital advising, "We have roughly a 1-week supply of masks." Another nurse from Alberta told us that after they refused to do COVID tests without the N95 mask that used to be called for, this didn't go over well. I was made to feel belittled and my concerns dismissed. And an Ontario nurse posted this. Less than a month ago, I could have faced disciplinary action for wearing the same mask between patients, but now it's what we're being told to do. I'm not safe. My patients aren't safe. Linda Silas is head of the Canadian Nurses Union. We connected over Zoom.
So Linda, some healthcare professionals that we've talked to are suggesting that we're in a global crisis, that nurses just need to share the pain, share the risk.
We're not going to share the pain or the risk with our lives. We work in that field knowing we need to be there, especially in these times of pandemic and other emergencies. But to do that properly, We need to be protected.
So as you can see, nurses are begging for more supplies and tell us that if we don't better protect them, we could end up like other places in the world where they are now begging for more nurses. Wendy Mesley, CBC News, Toronto.
Different provinces and cities are taking different approaches to managing the virus. Anita Bath is looking at what's happening in communities across the country.
Adrienne, let's start in Quebec this hour, where, as you heard earlier, more travel restrictions have been implemented. Travel has been limited to and from the regions on your screen. Patrol officers will be randomly stopping people to make sure you meet the criteria for essential travel, and if you don't, you'll be asked to return home. And despite mounting calls to lock down the island of Montreal, the Premier says that's not going to happen.
If we decide one day to do that, we would need to close also the suburbs, because north and south of the island of Montreal, there's a lot of traveling.
In Ontario, the city of Windsor has laid off nearly 550 employees. This is mainly people who work at arenas, pools, and community centers. The mayor says this isn't about saving money, but it will save $135,000 a week.
I think it's fair to say we're all dealing with the situation that's in front of us today. Could things even change, a month or 2 months down the road? Maybe. But we're trying to deal with the situation we see at least over the next month and make reasonable decisions on how we're going to position this organization to continue to function.
And the Ottawa Senators say 4 members of the organization have tested positive, bringing the total to 6. 2 members of the Colorado Avalanche have also tested positive. Adrienne?
One of the last places you can interact with people face-to-face these days is at the grocery store. But employees and officials are warning it's not supposed to be a social event. Kayla Hounsell explains.
This Toronto grocery store is taking physical distancing so seriously, it's hired bouncers.
I've worked at bars for 20 years.
Now she says people are treating it like it is a bar.
So they'll be standing on either side of a display, so they're still the 6-ish feet away, but they're chatting.
And officials across the country say socializing at the grocery store is not okay.
The reckless few, shame on you. We've had it.
One person, one trip each week. Don't take your children with you unless there is really no alternative. And please don't let them lick the handles on the shopping cart.
Oh, we're tired. We're not going to lie.
This store owner says most of his customers are respectful and appreciative, but he stresses people really need to stop shopping in groups.
If somebody's coming with their spouse or with one of their kids or something, it's okay today, we would tell them, but next time if you could please shop solo.
Some grocery store employees concerned about appearing on camera for fear of losing their jobs say they have been verbally abused by angry, frustrated, and impatient customers. They say they've been yelled at, even sworn at, and accused of overreacting as they try to enforce physical distancing measures put in place by their employers. Their union says they don't have to tolerate such behavior and should report it.
And we say, customers number one, right? They come first. But I don't think in this case it's true.
And safety measures are not just to protect customers and employees. Consider this. Lisa Walsh is a severely immunocompromised transplant recipient. 3 of her immediate family members work in grocery stores.
You could pass it on to me or an elderly person and never know it, and you could be responsible for that person's death.
A message from someone really afraid of the so-called reckless shoppers. Kayla Hounsell, CBC News, Halifax.
Well, today is a day a lot of Canadians were dreading, rent day. So tonight, we're taking a closer look at your money concerns.
Many people live paycheck to paycheck.
Should we pay April's rent?
Ahead on The National, the experts answer your questions.
It's just surreal, actually, knowing that I'm in a disaster zone in New York City.
And tens of thousands of healthcare workers descend on the U.S. epicenter of the pandemic.
And later, a stranger drops off envelopes of cash for grocery store workers, and the story doesn't end there.
They said, no, let's pay it forward.
We're back in 2.
Welcome back. The United States has just jumped over a horrible new marker, more than 200,000 confirmed coronavirus cases. And just as troubling, the vice president was comparing the situation there to what's happened in Italy. Susan Ormiston has more.
Someone loved, loaded directly into a makeshift morgue as the death toll doubles in 3 days. No end to the agony for the Big Apple.
It's just surreal, actually, knowing that I'm in a disaster zone in New York City.
More than 80,000 healthcare professionals have answered an urgent call for volunteers.
I'm an emergency medicine doctor in New York City.
As doctors on wards make their own videos to describe the virus in the lungs as a warning.
It's like you hit a tipping point, you start drowning, and you do really poorly.
The U.S. Vice President touring Walmart makes a stark comparison today.
We think Italy may be the most comparable area to the United States.
While in Florida, the governor finally bows to pressure.
Directing all Floridians to limit movements and personal interactions outside the home.
Weeks after, packed beaches on spring break, and still packed churches last Sunday.
Of course, we got the what they call social distancing in here in this room.
This pastor was arrested in Tampa.
But we're glad you came today.
Right there.
Another yesterday in Louisiana live streamed as he was served a summons from local sheriffs.
I'm exercising my First Amendment rights.
And then continued on with his nightly service. But to Americans losing family, no gatherings are safe.
They took a walkie-talkie and they placed the walkie-talkie right by her bedside.
His mom survived breast cancer, but died with the coronavirus.
I told her I loved her. I told her everything's going to be all right with the kids.
Another painful goodbye, separated like thousands of others from those they love. Susan Ormiston, CBC News, Washington.
As for the situation in Italy right now, it's still really disturbing. More than 13,000 people have died there. That is the most in any country. And in Spain, another day of hard-to-fathom numbers. Its highest daily death count yesterday was surpassed again today. 864 more people gone in 24 hours. 6 of the 10 countries hardest hit by COVID-19 are in Europe. Margaret Evans has more from London.
Emptied of people shielding from the virus, Europe's great capitals feel both hollowed and abandoned. Even Rome's Colosseum looks like a child's forgotten toy when viewed from above. On the ground, for Italy's children today, there was a brief ray of light, rules now allowing them a daily walk, if only a brief one. We're scared to be outside, says this father. The lockdown has been our salvation. The measures are working, and I want them to continue. Italy is by no means out of the woods. The lockdown now extended until mid-April, and doctors still worry about having the right protection. More than 60 have died. We feel vulnerable, says Dr. Antonio Maggi. We've been sent in empty-handed in Italy and around Europe. In Madrid, another hollowed-out capital, the dreadful stock-taking continues. Here, the army is shepherding the sick to a new makeshift hospital, the number of confirmed infections now tipping over the 100,000 mark. It leaves a country navigating dark corridors of the soul. Here in the United Kingdom, worried officials hope to avoid the same fate. But there's growing anger over the government's failure so far to live up to promises on massive boosting to testing and tracking.
It does beg a belief that we didn't actually sort of act quicker because we knew, because we'd done an exercise, we knew that we had these challenges.
From the royal family, there was a message from Prince Charles, now recovered, he says, from the coronavirus, and urging hope and faith.
None of us can say when this will end, but end it will.
What, though, will it leave in its wake? Margaret Evans, CBC News, London.
Well, this being the first of the month, rent day for a lot of people, we are changing things up, answering your financial questions with a team of experts. Questions such as this: As a retiree, I may not be able to wait for my investments to rebound before I need access to them. Is there any government assistance for me? Should I be cashing out on a portion of my investments? That's next. But as we go to break, we asked, what about this pandemic keeps you up at night? We'll have Canadians answering that question in their own words. Here's our first pandemic diary.
Hello, my name is Craig McMillan, and this is my restaurant. I've invested basically every penny I have in the restaurant, and I'm not doing very well right now, as many restaurants aren't. What keeps me awake at night is worrying about all of my employees and my bills. If my bills don't get paid, there are implications for everybody who I don't pay, as well as myself. However, for my employees, there's sort of a greater implication. In the time that we've been operating, I've spent pretty close to $500,000 in payroll, and we've ended up with 18 people who are the most excellent people I can imagine. And I want to keep those employees, and I'd like to be able to look after them and their families. Sadly, if this continues, we may not be able to do that.
CBC Listen. Hear it all here. Download today.
Tonight, we are taking a closer look at the financial cost of COVID-19 on your lives. It is, of course, the start of a new month, and for many Canadians, that means rent and other bills are due. Something made even more challenging than usual in these uncertain times. Peter Armstrong looks at where things stand and where they might head next.
The numbers are so big, they hardly make sense anymore. But with so many of us working from home or not at all, the toll on the economy is simply unprecedented. Factories, malls, and office towers have emptied out. 1.5 million jobless claims made in a week. 213,000 people asking their bank to defer mortgage payments, and countless others struggling to pay the rent. And this is just the beginning. Unemployment could soar as high as 15%. That would mean more than 3 million Canadians out of work. People who were already straining under sky-high debt loads, now half of Canadians say they're on the brink of insolvency. What savings they did have were crushed as global stock markets plummeted. The Dow, the S&P, and the TSX all down more than 20% since the outbreak began. Small and medium-sized businesses are particularly hard hit. Your local barber, florist, or restaurant don't have much cushion to survive a bad week, let alone whatever this is. These companies make up more than 70% of private sector employment in Canada, but they also make up the character of our towns and neighborhoods. This is a crisis unlike any other.
I have no idea what I'm going to do.
It will reshape those businesses and how we interact with them. And many of those changes will last much longer than these weeks or months of isolation. Peter Armstrong, CBC News, Toronto.
Now, as Peter just mentioned, Canadian businesses are especially hurting. But today, the federal government says relief is on the way, filling in some details of its emergency wage subsidy program.
The Canada Emergency Wage Subsidy would be available to Canadian businesses, big and small, individuals, partnerships, and corporations that are not publicly funded.
To qualify, businesses need to show a 30% drop in revenue compared to the same month last year. In those cases, the subsidy would cover 75% of each employee's salary, up to $58,700, or a maximum of $847 a week. Employers would need to reapply each month on the CRA's website, but there's still a delay for that to start, up to 3 to 6 weeks. Though when the money does come in, it would be retroactive to March 15th. Well, this is typically the part of the program where we bring in our panel of doctors, but tonight we are doing things a little differently. We're still taking your questions, but we're focusing on what COVID-19 means for your finances, for your bottom line. And here to answer your questions, 3 personal finance experts. David Sung is in Vancouver, Carrie Taylor is in Vernon, BC, and Tim Sesnick is in Burlington, Ontario. Hello to the 3 of you, and we'll dive right in with our first question, and it comes to us by video.
My name is Wendy Young. I'm 46 years old. I own a laser and wax bar in downtown Toronto. My biggest worry is, what do I sacrifice between my personal life and my business. Something has to give.
Boy, so Tim, the specifics will be hard to get into, of course, but even just strategically, how should she try to answer that question?
Well, you know, Andrew, I think everybody needs to sit back at this point in time and ask themselves the question, where am I spending money, both in my business and personally, and what are really my needs and what are my wants? When it comes to wants, I think we all need to sit back for a second and say, maybe it's not time to spend money on wants, but maybe what we're is focusing really on the needs instead. I think also when it comes to, you know, do you spend money in your business, do you spend personally? Keep in mind that as you spend money in your business, you may be able to deduct those costs, which actually may be able to save you some taxes. So keep that in mind. It may not be the right answer for everybody. I think people should be talking to their tax advisor about that. But right now, ask the question, what is my greatest need right now? And how can I best meet that need? And that should help you to guide the decision as to where you're going to spend money personally or in your business, and where should you really cut back.
All right, Carrie, we'll have you field this next question. Have a listen.
Hi, my name is Aisha. I'm a fourth-year student at Ontario Tech University. My question is, many people live paycheck to paycheck. How are they expected to survive waiting for benefits to kick in with little to no savings put aside?
We've gotten that question an awful lot. How the heck do I make ends meet if I don't have the money to do it?
It's a big question, and for sure, a lot of Canadians were stretched to the limit before this crisis, and they're absolutely stretched now. First and foremost thing is, don't worry about your credit score, your credit report. The most important thing is your health. Your health is your wealth in this situation. Your priority should be going to paying for food and medications, okay? So after that, we need to sit down and we need to look at how to get some more income in. So be sure to apply for the Canada Emergency Response Benefit. Go to My CRA when it's available April 6th and apply for it. It's about $2,000 a month for up to 4 months, and that can help a lot make ends meet. The second thing is you need to look at what your expenses are right now. This is serious. So look at what your debt repayments are, look at what services you pay for, and pick up the phone and see if you can get some relief with your service providers and your financial institutions. Many of them have financial relief plans in process. Now, the third thing to do is I'm really concerned that people living paycheck to paycheck are going to hit up the payday loan circuit. This is a stopgap measure that is just going to become more painful in weeks to come. Because if you borrow like $400 this week, the interest rates are so high, it's going to balloon to $400, $500, $600 in weeks from now. And it's just going to make a hard situation worse. So if you're unable to use these benefit programs that are coming in as a stopgap measure to help your income and ease out your expenses, I would recommend, don't be afraid, pick up the phone and call a licensed insolvency trustee. These are good people with great ideas that can help you mitigate collection callers and help deal with these financial pain points before they get worse. And a lot of them can give a free consultation, so they can help take your exact situation and see what to do. And some of them may say do nothing because the courts are closed right now.
Right. And you mentioned the response benefit, and there is going to be another question a little bit later on the CERB. But David, here's one that I'll throw your way, and we'll try to put this one up on the board for you. So as a retiree, I may not be able to wait for my investments to rebound before I need to access them. Is there any government assistance for me? And should I be cashing out on a portion of my investments?
There are a few measures, but let me start with one measure that there will not be, at least in my best guess. There is no measure to help people prevent losses from their investments declining in value. But let me start with the good news. The good news is over the past 90 years, there's been many stock market crashes and many bear markets. And after each one of these, including the tech bubble and the credit crisis, which in each one of those, the markets declined over 50% in value, and we're nowhere near that right now. After each one of those, the market has gone on to new highs. So I put that out there as the good news. It's really important for investors in any portfolio design to ensure that the income that their portfolio generates, interest, dividends, and other portfolio income, that provides them with the cash flow that they require so that they don't put themselves in a position to cash out investments. Having said that, if you plan a income stream that involves drawing down on capital, then you're going to want to know that your portfolio has capital in a safe place, such as bonds and fixed income. And so those are some of the things that investors should take the time to relook at with their advisors to ensure they have the right portfolio design. But in terms of some short-term measures, the government has indicated loosening up on the minimum withdrawals required for retirees to take from their registered retirement income funds. That slows the forced withdrawal from a portfolio, helps to mitigate losses. And of course, there's been the deferral on taxes out a little bit further into this year. So those are all measures that a retiree should look at in order to not dip into their investments and potentially draw down on anything in a loss position.
Okay, Tim, I'm going to give you the last word on this just because I know there are a lot of folks who have questions about the CERB. I'm finding it hard to determine if I'm eligible for it. Do you have tips on navigating the new policies?
So as Kerry alluded to, the Canada Emergency Response Benefit, the CERB, is something that will be available starting April the 6th. You can go onto the canada.ca website to apply for it. Now, who qualifies? Basically, any Canadian who is out of work, who's become out of work because of COVID-19, will be entitled to apply for this benefit. Now, there are some restrictions. You have to be age 15 or older. You had to have had $5,000 or more of income last year in 2019. There are some gray areas we're not quite sure about. For example, if you're a student and you planned on getting a job this summer, or maybe you had a job lined up and it's not available anymore, can you still apply? We don't know that, but the government has said you had to have been working. So, it's not clear whether a student will qualify. But if you were working and you've been out of work for 14 days, my best advice is this. If you're not sure, apply for it. And you go onto the Canada website, and you can apply there starting April the 6th.
To the three of you, Tim, Kerry, David, thanks so much for your advice. Now, tomorrow night, our panel of doctors will be back here as usual, taking your questions about the COVID-19 pandemic. So send us any you've got, either through Instagram at CBC The National, or you can send us an email at covid@cbc.ca, and just be sure to put The National in the subject line.
Next, a closer look at the detective work that goes into tracking the virus in the name of stopping the virus. You'll meet the contact tracers who literally follow the virus from person to person, why you may be called into action. But first, the Getty Museum in Los Angeles may be closed, but it set up a challenge for people who can't visit to recreate a work of art using whatever they have at home. Well, thousands have responded. Here's Vermeer's The Astronomer. This is Norman Rockwell's Girl with a Black Eye. And Sarah Johnson from Kelowna, BC, took this portrait of an Italian girl.
The camera on my iPhone was timed so that I had enough time to set the thing, pose, and I took about 10 pictures, and then I was like, okay, that's it. I can't stay here all day.
Getty called the recreations ingenious and hilarious, and a bright spot during a tough time. Getting COVID-19 under control will take more than physical distancing. It will require a surge in contact tracing. That's the step-by-step detective work to find everyone an infected person has contacted. Done right, it's worked well elsewhere. Now there are calls to train more Canadian sleuths before more people get sick. It's only been a few weeks of distancing for Canadians, but doesn't it already look strange to see people out together, so close together? Strange, too, to know these aren't old pictures. This is Singapore days ago, a densely populated city-state of 6 million making huge leaps at confronting COVID-19. Only 1,000 cases, less than half a dozen deaths. Look at its enviously flat curve, and now look at Canada's. The contact tracers of Singapore are crucial. Their detective work identified more than 50% of all cases, most people who had no idea they were infected. One trace can take hours with each person who tests positive.
So we go down breakfast, lunch, dinner, supper, and tea if it's in between, and then we traced out who are the people that for each of those contacts they could have come in contact with.
Then, in partnership with police, contacts are visited, they sign agreements to stay quarantined, and know it's jail if they don't. It's so effective, some commerce has been able to stay open. So how's Canada faring on contact tracing?
So the majority of jurisdictions actually have for now, but a few have said, look, if the cases go up in the next couple of weeks, we're going to need some help.
They will need help and will likely turn to a place like this, a tracing centre in Alberta. The province leads the way in mobilizing tracers, public health nurses in conjunction with newly trained medical students. Over 300 of them taught how to do this by Rochelle Schindler.
That whole team together is doing every single case in Alberta right now. So I believe that's about 60 a day. And we're definitely not maxed out. We can do more.
It's picking apart credit card statements, bus schedules, helping someone already stressed remember vital details. Initially, some thought contact tracing would only be effective in the early days, that the virus would eventually outpace efforts to chase it. Success stories prove that wrong.
One thing we've learned from China, South Korea, Japan, is that you never stop doing this work. Through aggressive contact tracing and isolation of contacts, they were able to get it under control.
If you think you can help do this, she advises, consider contacting public health agencies. They may soon need more Canadians to step up.
Meanwhile, COVID-19 is changing how we do the most mundane of tasks. So next, we continue our regular how-to series with a situation you could very easily find yourself in. Okay, so you get into an elevator and someone else is there. And let's assume the worst. They're infected with COVID-19. How likely are you to become sick as well?
I'm Jamie Poisson, and tomorrow on CBC's daily news podcast, Front Burner, there are now several cases of COVID-19 in Canada's prisons. We hear from people inside prisons about what they're seeing and what they fear. Subscribe wherever you get your podcasts.
So you're following all the rules, keeping your distance, but there's some places where close contact is unavoidable. Tonight, as part of our regular how-to on navigating COVID-19, staying safe in an elevator. Okay, so you get into an elevator and someone else is there. And let's assume the worst. They're infected with COVID-19. How likely are you to become sick as well?
So in your everyday scenario, people coughing or sneezing, it doesn't actually get suspended in the air. It simply travels in these droplets. And these droplets will, they'll hit a surface or they'll land on the ground, but they won't stay suspended in the air.
So if someone coughs or sneezes, your best defense is simply to face a different direction. Remember, it is your face that you're trying to protect. That's where the germs go in. As long as they're not spraying those germs directly at you, they're largely not going to get on you. But where do those germs go? Well, ideally, into the person's sleeve. Otherwise, they're going here or down here somewhere, or maybe even on the buttons here. So safest assumption is simply everything is contaminated, wash your hands, and don't touch your face.
Always good advice. Next on The National, a mysterious donation. How one anonymous customer honored the community grocery store workers. Our moment is next.
CBC Listen. Hear it all here. Download today.
Well, these staff here aren't just grocery store workers. They're some of the heroes who keep coming to work day after day after day. Now, one of their customers wanted to acknowledge their work and so dropped off an anonymous gift just for them. And the acts of kindness did not stop there. It's our moment.
So we had a customer come in and they dropped off 10 envelopes. Each envelope had a little saying. It would say, thanks for working, thanks for working during COVID-19. Each one of them that I opened had $40 cash. We came up together as a team and I said, we have $400. We could use it for staff. And they said, no, let's pay it forward. And we thought, what a better time than to do 4 seniors for $100 worth of groceries each. The surprise thing was, well, wow, somebody recognized us coming to work during this. We were all blown away that somebody, did this for us, and we just wanted to make sure we put it back out in the community.
And Patty says she's not at all surprised that her staff did that, that's just the sort of people they are. And very clearly, the act of paying it forward is definitely going to be the sort of thing that gets everyone through this.
Yeah, well, whoever said money can't buy happiness, huh? You spend it like that, and it'll bring it in spades. That's The National for this April 1st. Good night.
Good night.